Hello, good morning. I am Kamilah, Mendoza, and I will talk about eating disorders. But before that, I will read first the objectives of this presentation. These are the objectives. Understand what are eating disorders, know the causes of eating disorders, know the signs and symptoms of an eating disorder, know some common types of eating disorders, know the simple ways to prevent eating disorders. So, what are eating disorders? Eating disorders are behavioral problems marked by significant and persistent changes in eating habits, as well as disturbing thoughts and emotions. They can be life-threatening illness that affect physical, psychological, and social functioning. Eating disorders frequently happen with other psychiatric diseases, such as mood and anxiety disorders, obsessive compulsive disorders, and issues with alcohol and drugs. Although eating disorders can affect persons of any gender at any age, teens and young women are the most commonly affected. Up to 13% of teenagers may face at least one of these issues. What are the causes of eating disorders? The exact cause of eating disorders is unknown. However, many doctors believe that a combination of genetic, physical, social, and psychological factors may contribute to the development of an eating disorder. For instance, research suggests that serotonin may influence eating behaviors. Serotonin is a naturally occurring brain chemical that regulates mood, learning, and sleep, as well as other functions. Social pressure can also contribute to eating disorders. Success and personal worth are often equated with physical beauty and slim body. With physical beauty and a slim body, especially in Western culture. The desire to succeed or feel accepted may fuel behaviors associated with eating disorders. What are the signs and symptoms of an eating disorder? Symptoms vary with each disorder, but the most common symptoms include abnormal low or high body weight, an irregular diet, the desire to eat alone or secretly, using the bathroom frequently after a meal, obsession with losing or gaining weight quickly, obsession with physical appearance and perception of body by others, feelings of guilt and shame around eating habits, experiencing abnormal stress or discomfort about eating habits. These are the types of eating disorders: anorexia nervosa, bulimia nervosa, binge eating disorder, BED, pica, rumination disorder, avoidant restrictive food intake disorder, ARFID. What is anorexia nervosa? Anorexia can be identified by unusually low weight and an entire desire not to gain weight or eat too much, if at all. Anorexia is characterized by behavior meant to avoid gaining any weight at all, often to the point of malnourishment. With anorexia, a person may also see themselves as overweight even if their body weight is far below normal. These are two types of anorexia nervosa: restricting type, in which individuals lose weight primarily by dieting, fasting, or excessively exercising; binge eating or purging type, in which persons also engage in intermittent binge eating and/or purging behaviors. Over time, some of the following symptoms may develop related to starvation or purging behaviors: menstrual period cysts, dizziness or fainting from dehydration, brittle hair or nails, cold intolerance, muscle weakness and wasting, heartburn and reflux in those who vomit, severe constipation, bloating and fullness after meals, depression, irritability, anxiety, poor concentration, and fatigue. Treatment for anorexia nervosa involves helping those affected normalize their eating and weight control behaviors and restore their weight. Medical evaluation and treatment of any co-occurring psychiatric or medical conditions is an important component of the treatment plan. What is a bulimia nervosa? Individuals with bulimia nervosa typically alternate dieting or eating only low-calorie, safe foods with binge eating on forbidden high-calorie foods. Binge eating is defined as eating a large amount of food in a short period of time, associated with a sense of loss of control over what or how much one is eating. Binge behavior is usually secretive and associated with feelings of shame or embarrassment. Binge may be very large, and food is often consumed rapidly beyond fullness to the point of sickness and discomfort. With bulimia, you may believe that you're overweight, even if your weight is normal, slightly above normal, or even below a healthy weight. Possible signs that someone may have bulimia nervosa include frequent trips to the bathroom right after meals, large amounts of food disappearing or unexplained, empty wrappers and food containers, constant sore throat, swelling of the salivary glands in the cheeks, dental decay resulting from erosion of tooth enamel by stomach acid, heartburn and acid reflux, laxative or diet pill misuse, recurrent unexplained diarrhea, misuse of diuretics, water pills, feeling dizzy or fainting from excessive purging behaviors resulting in dehydration. Outpatient cognitive behavioral therapy for bulimia nervosa is the treatment with the strongest evidence. It helps patients normalize their eating behavior and manage thoughts and feelings that perpetuate the disorder. Antidepressants can also be helpful in decreasing urges to binge and vomit. What is a binge eating disorder? BED. As with bulimia nervosa, people with binge eating disorders have episodes of binge eating in which they consume large quantities of food in a brief period, experience a sense of loss of control over their eating, and are distressed by the binge behavior. Unlike people with bulimia nervosa, however, they do not regularly use compensatory behaviors to get rid of the food by inducing vomiting, fasting, exercising, or laxative misuse. With BLD, you may continue eating long after you feel full, sometimes to the point of discomfort or sickness. BED can happen to people of all sizes and weights. The diagnosis of binge eating disorder requires frequent binges, at least once a week for 3 months, associated with a sense of lack of control with the three or more of the following features. Eating more rapidly than normal, eating until uncomfortably full, eating large amounts of food when not feeling hungry, eating alone because of feeling embarrassed by how much one is eating, feeling disgusted with oneself, depressed, or very guilty afterward. As with bulimia nervosa, the most effective treatment for binge eating disorder is cognitive behavioral psychotherapy for binge eating. Interpersonal therapy has also been shown to be effective, as have several antidepressant medication. What is a pica? Pica is an eating disorder in which a person repeatedly eats things that are food with no nutritional value. The behavior persists over for at least 1 month and is severe enough to warrant clinical attention. The behavior is inappropriate to the development level of the individual and is not part of a culturally supported practice. Pica may first occur in childhood, adolescence, or adulthood, although childhood onset is the most common. It is not diagnosed in children under age 2. Putting small objects into their mouth is a normal part of development for children under 2. Pica often occurs along with autism spectrum disorder and intellectual disability, but can occur in otherwise typically developing children. A person diagnosed with Pica is at risk for potential intestinal blockage or toxic effects of substances consumed. Treatment for Pica involves testing for nutritional deficiency and addressing them if needed. Behavior interventions used to treat Pica may include redirecting the individual from the non-food items and rewarding them for setting aside or avoiding non-food items. What is a rumination disorder? Rumination disorder involves the repeated regurgitation and rechewing of food after eating, whereby swallowed food is brought back up into the mouth voluntarily and is rechewed and reswallowed or spat out. Rumination disorder can occur in infancy, childhood, and adolescence, or in adulthood. To meet the diagnosis, the behavior must occur repeated over at least 1 month period, not be due to a digestive or medical problem, not occur as part of one of the other behavioral eating disorders. Rumination can also occur in other mental disorders. However, the degree must be severe enough to warrant separate clinical attention for the diagnostics to be made. And for the last eating disorder, what is a avoidant restrictive food intake disorder? ARFID. Avoidant restrictive food intake disorders ARFID is a recently defined eating disorder that involves a disturbance in eating result in persistent failure to meet nutritional needs and extreme picky eating. In ARFID, food avoidance or a limited food selection can be due to one or more of the following: low appetite and lack of interest in eating or food, extreme food avoidance based on sensory characteristics of foods, anxiety or concern about consequences of eating such as fear of choking, nausea, vomiting, constipation, an allergic reaction, etc. The disorder may develop in response to a significant negative event such as an episode of choking or food poisoning, followed by the avoidance of an increasing variety of foods. The diagnosis of ARFID requires that difficulties with eating are associated with one or more of the following: significant weight loss, or a failure to achieve expected weight gain in children, significant nutritional deficiency, the need to rely on a feeding tube or oral nutritional supplements to maintain sufficient nutrition intake, interference with social functioning, such as inability to eat with others. Treatment for ARFID involves an individualized plan or may involve several specialists, including a mental health professional, a registered dietitian, nutritionist, and others. These are the simple ways to prevent eating disorders. Building healthy eating habits. 1. Set a good example by eating well. Good habits to demonstrate include eating a varied diet that includes lots of fruits and vegetables, whole grains, fiber, lean protein, such as poultry breast or fish, and healthy fats, like those found in seeds, nuts, and vegetable oils. Limiting sugary, processed, and greasy foods. Taking time to enjoy and celebrate your meals, especially with family and friends. 2. Avoid making negative or shaming comments about food and eating. For example, don't say things like, I feel so guilty about eating this Coke, or, or you shouldn't eat so many rice, you'll start putting on weight. Instead of focusing on taking away foods, focus on how you can add more good nutrition to your diet. Try not to praise people for dieting or avoiding food. Instead, demonstrate that you enjoy good food and feel positively about eating. That's all. Thank you for listening.